Hello and welcome to Card Creative Coaching. Today I wanted to follow up on last week's post on seasonal affective disorder. I wanted to shed some light last week on this literal dark disorder, and hopefully I did that. But today I want to talk about what you can do about depression, whether it's SAD or other forms of this pervasive mental illness. If you clicked on the links attached to the last post, going to the Mayo Clinic, you'd see that there are some recommendations there for treatments, things like light therapy or medication or talk or action-based therapy. So let's review these. Light therapy, this is specifically designed for seasonal affective disorder. It's the loss of light during the day that affects us, so you can get special lamps which simulate the benefits of sunlight. Unfortunately, regular light bulbs don't seem to do it, and because these lamps are specialized, they're often not cheap. But they can really help some people, and if you're suffering from SAD specifically, then this might be something you can give a try. For medication, so I know medication can be a divisive subject. Some people say it's the best way to relieve depression. Others say it's nonsense and placebos work just as well. So what's the truth? Medications can and do help. They relieve symptoms of depression. And that wording is important. I'll get back to that. Imagine a scale of -10 to 10. And the negatives are depression and the positives are happiness. And when you're in that negative area, it's just hard to function. So medication can help you get from that negative space to a more neutral space where you start to be able to function, where you can take care of your life, where you can take care of things and start to get back to normal. The medications help most in cases of severe and chronic depression. They help lift the person from those depths to a place where, as I mentioned before, they can start to function. However, in cases of mild to moderate depression, medications still work, but their success rate is really only about 25% more or better than a placebo. So medications do help, primarily for those with severe depression, but even in other cases, they can be a literal lifesaver. So let's talk about therapy. There are various kinds of therapy, from behavioral to talk therapy, and all of these can be very effective against depression. Interestingly, though, their success rate is really only about the same as medication. Both seem to have about a 65% success rate in most cases. The positive of therapy is that it helps to put action into a person's hands. The therapist is helping them to help themselves in everyday life, which means that the person is building internal and external strategies for dealing with depression and for moving on and living their lives. The negative of therapy is that it can take a long time, especially if there's a lot of junk that we need to deal with. So you need to be prepared for this to be a long haul. And if you do that, then this is something that can really help and change your life. So it's not always even just one of these. Sometimes it's a mix of these treatments that works well for people. A little bit of light therapy with the right medications and the right therapist can be a powerful combination. So now that I've gone over all of that, I've got some good news and I've got some bad news. And I'll give you the bad news first. Of all of the treatments for depression, they alleviate symptoms, and that's a good thing. And yet, even for talk therapy, I'll read out the exact line from the Mayo Clinic site. They identify and change negative thoughts and behaviors that may be making you feel worse. So medications alleviate symptoms, and talk therapy helps you not to feel worse. Can you see where this is going? When you're working with these things, the point is that you're not feeling as bad. The point is, did it get you to neutral? To quote one psychologist, I would help a patient get rid of all of his anger and anxiety and sadness, and I thought I would then get a happy patient. But I never did. I got an empty patient. If you get rid of all of the negative, but you don't replace it with something else, you're not going to have a happy person, you're going to have a not depressed person. And that's a good start, but it's not really what we want, is it? And that's sort of the bad news. So what's the good news? Well, there are scientifically proven ways to increase your happiness level. It does take work, but if you dedicate yourself to them, you can really change your life for the better. And because I've already run a little long on this post, I'm going to talk about some of these ways in my next video. Before that, I just want to give a shout out to Dr. Seligman and his book Flourish. A lot of what I've learned about depression and happiness has come from him. So it's a good book. Again, it's Dr. Martin E.P. Seligman, and the book is Flourish. So if you're interested in more information, feel free to pick that up. And until my next post, I hope you can dream big, laugh lots, and create. Thank you.